Chapter 9 is about articulations, which is another word for joints. So, first off, we should probably define that. Joints, you might think of joints as something that moves, but actually, as we will discover, there's some joints don't move at all. Better definition of articulation is where two bones meet, two or more bones are connected to each other. In this chapter, we'll look at structure and mobility of different types of joints, the movements you can do at synovial joints in particular, and we'll define what that is as we go. For a clinical portion, we'll be looking at the different types of arthritis. So arthritis would be swelling, inflammation of the joints. And finally, we will examine a couple specific joints. You'll find in your textbook at chapter 9, in the second half or so, they describe in detail a lot of specific joints in the body. And we don't have time to do all of those. We're going to examine two that are commonly injured, the knee and intervertebral joints. So, to make sure you just read and focus on the parts that we're covering that you need to, make sure you check your study guide for details about exactly which portions. We can classify joints in a couple different ways. So classifying means like sorting them into different categories. We could classify them by structure, and that would be what is holding the bones together. And you have a few options. You could have fibrous, and specifically, fibrous joints are held together with collagen fibers and nothing else. Cartilaginous joints are held together with cartilage and nothing else. Synovial joints are held together by lots of things. And we will examine the anatomy of a synovial joint as we go. A synovial joint is the most complex, and it has a lot of different structures that are keeping those bones together. The other way that we could classify joints, functional, refers to simply how much does it move. And we have, as you can see, 3 options here. I want to stop for just a moment and point out that all these words have arth in them. And arth means joint. So arthritis would be joint inflammation. Our 3 options for how much a joint moves. Synarthrosis, no movement. None. It does not move at all. So you do have joints that do not move. Amphiarthrosis, Amphiarthrosis is slightly movable. And diarthrosis is fully movable. Or another term your book would use, freely movable. These joints move a lot. Now, these 2 classification systems, they almost match up. So joints are categorized in similar ways with these 2 classifications, but there are slight differences. So fibrous joints, almost all of them are synarthrosis. So almost all your fibrous joints do not move. Almost all of your cartilaginous joints are amphiarthrotic, which means they're slightly movable. And all of your synovial joints, every single one, is a diarthrosis. All your synovial joints can move freely. Let's start with fibrous joints. So fibrous joints are connected by dense fibrous connective tissue. So collagen. And that's it. Nothing else. Again, most of them are synarthrotic. I'll give you one exception as we go. And there's 3 different types that you can find in the body. You can see here. The first one, I'm going to pause and do a grammar lesson again. you can see this ES versus IS. So ES is plural, the IS is singular. Gomphoses, that is the joint between your teeth and the alveolar processes of either your mandible or your maxilla. So the alveolar processes would be this hole, which you should have seen in lab when you were studying the skull. So there is a joint between that socket and your actual tooth. Sutures. Sutures, you've already seen sutures. Sutures are the joints between the bones of your skull. There's a little bit of collagen tissue holding those together. These first two, the gomphoses and the suture, these are both synarthrotic, which means you cannot move these joints. Ideally, sometimes if you have like gingivitis and maybe some swelling and infection, perhaps your tooth might loosen a little bit. That's not ideal though. It shouldn't be able to move it. Sutures, you definitely should not be able to move those bones of your skull. The only bone of your skull that should be able to move around is the mandible that you elevate and depress. But that's not a sutural joint. There's a synovial joint sitting right there that allows you to move your mandible relative to the rest of your skull. Okay, so the final type, syndesmosis, is the joint between the radius and the ulna. And there's one other example I'll tell you in a minute. But this joint is just simply this interosseous membrane made of collagen that holds the radius and the ulna together. It is actually slightly movable. So it is amphiarthrotic, but it doesn't move very much, just a teeny bit. I misspelled that, sorry, amphiarthrotic. You also have another syndesmosis in your body between your tibia and your fibula, so in your leg. This one, though, is synarthrotic. You cannot move that one. Cartilaginous joints, bones that are united or held together by pieces of cartilage. You have two types of cartilaginous joints. Actually, just notice generally how many SYN words there are. Just back up for a second. I know this is annoying. When I first learned joints, it was just a nightmare to remember all these words. So try and drill them into your head as soon as you can. We've got this SY, synarthrosis. You've got this SY, this SY, your syndesmosis. And then we add yet another SYN word, synchondrosis. But again, chondro is going to be a little bit helpful there because at the very least, you know, this one in particular is cartilaginous because we know chondro means cartilage. And then you have an SYM, which is very, very close. Yeah, sorry about the similarity in all those words. Syn would just mean together, like synergy is another example of an SYN word. So having SYN words with joints, not very surprising. Synchondroses are made of hyaline cartilage. Couple examples, the epiphyseal plate, which we already know what that is present in children. And it is the joint between the epiphysis up here and the diaphysis. It is technically a joint. It's two bones held together by a piece of cartilage. Another example of a synchondrosis is actually the joint between the sternum and your ribs. So you have several synchondroses. And it's a big piece of cartilage, as you can see. But nonetheless, that is a joint. So our second type of cartilaginous joint is symphyses, and they are held together with fibrocartilage. So a different type of cartilage. Sorry, that was a misspelling. Okay, so these are stronger. Fibrocartilage has thicker, more dense collagen fibers in it, so it's a much stronger cartilage. So you find these joints, symphyses, at places where you're going to have a lot of force acting on that joint. We've actually heard of both of these because these were the two examples I gave you for fibrocartilage. This joint between the two pubic bones. So here's one pubic bone over here, another pubic bone over here, and in between them, we've got a little pad of fibrocartilage holding them together. Between the bodies of the vertebrae, we've got one vertebrae, two vertebrae, so those are two separate bones, and they are held together with a piece of fibrocartilage. So it's a symphysis joint. Most of these cartilaginous joints are amphiarthrotic, meaning they can move a little bit, except your epiphyseal plate. It is synarthrotic. You should not be able to move this plate relative to the diaphysis. But the rest of these all move, as we will learn when we get to respiration, or actually, we've already done the muscles of respiration at this point. You'll know that the rib cage can expand, so these ribs can move a little bit up and a little bit out every time you inhale. So you got a little bit of movement here. And then pubic symphysis, also amphiarthrotic. As you walk, you do move your two pelvic bones. Finally, as we know, we can move our vertebral column. We can flex and extend and laterally flex. So yes, there's movement between these vertebrae.